Have you ever had a cough that just wouldn't go away? Maybe it lasted weeks, even months, and you thought, it's probably nothing serious, just lingering from that cold I had. And for most people, that's exactly what it is. But what if it's not? What if that persistent cough, that shortness of breath you've been brushing off, is actually your body trying to tell you something much more important? My name is David. I'm a general practitioner working at Mayo Clinic in the United. One of the most critical lessons I've learned in my years of practice is this: lung cancer doesn't always announce itself with dramatic symptoms. In fact, by the time many people notice something's wrong, the disease has already progressed significantly. Here's the reality. Lung cancer is one of the leading causes of cancer-related deaths in the United States, but early detection dramatically improves survival rates. The challenge is that early-stage lung cancer often produces subtle symptoms, or no symptoms at all. That's why understanding the warning signs and knowing when to seek medical evaluation can literally save your life. In the next few minutes, I'm going to walk you through 6 critical warning signs of lung cancer that you need to recognize. Some of these may surprise you, and some you've probably experienced yourself and dismissed. By the end of this video, you'll understand not just what these symptoms are, but why they happen, what they mean, and what you should do if you notice them.
First, let me explain what's actually happening inside the lungs when cancer develops. Your lungs are made up of delicate tissue called lung parenchyma. This is the functional tissue that allows oxygen to pass into your bloodstream and carbon dioxide to be expelled. When lung cancer begins, abnormal cells start multiplying uncontrollably within this lung tissue. As these cancer cells grow and form tumors, they don't just sit there passively. They actively invade the surrounding healthy lung tissue. They can press against airways, interfere with normal breathing mechanics, damage blood vessels, and irritate the nerve endings throughout the lung. This invasion and disruption is what causes the symptoms we're about to discuss. The key thing to understand is that these symptoms typically appear when the tumor has grown large enough to cause mechanical problems, pressing on structures, blocking airways, or damaging tissue. That's why screening is so important for high-risk individuals, because it can detect cancer before symptoms ever develop. Now, let's talk about the 6 warning signs. The first and often most common warning sign is a cough that just doesn't quit. When a tumor grows in the lung tissue, it can irritate nerve endings in the airways and lung parenchyma. Your body interprets this irritation the same way it would interpret any foreign substance in your respiratory system, by triggering the cough reflex to try to expel it.
But here's what makes a lung cancer cough different from a regular cold or flu. It persists. When you have a cold, you might cough for a week or two. Even with COVID-19 or certain respiratory infections, you might cough for several weeks to a couple of months. But a lung cancer cough doesn't follow that pattern. It continues relentlessly, week after week, month after month. It's chronic, ongoing, and often gets worse over time rather than better. Many of my patients tell me they assumed it was just allergies or that they were prone to coughs. Some thought it was related to their work environment or seasonal changes. The critical difference is the duration and the lack of improvement. If you've been coughing consistently for more than 3 weeks without clear improvement, especially if you don't have other signs of an active infection like fever or body aches, that's a red flag that warrants medical evaluation. The second warning sign is increasing difficulty breathing. As a lung tumor grows, it can physically compress or narrow the airways, the bronchi and bronchioles that carry air in and out of your lungs. Think of it like a partially blocked pipe. When the airway is narrowed, less air can flow through, which means less oxygen reaches your bloodstream.
Initially, you might only notice this during physical exertion. Maybe you're walking up stairs that never used to bother you, and suddenly you're winded. Or you're doing yard work or playing with your kids, and you find yourself needing to stop and catch your breath more often than usual. As the tumor continues to grow and the airway becomes more obstructed, the shortness of breath worsens. Eventually, it can affect you even at rest.
What makes this particularly concerning is that it's progressive. Each week or month, you notice it's a little bit harder to breathe during activities that used to be effortless.
This gradual worsening is characteristic of a mechanical obstruction, something physically blocking the airway and getting larger over time. If you're experiencing this pattern of progressive breathlessness, especially if you're not significantly overweight and don't have a history of heart or lung disease, you need to get it checked out promptly.
This third warning sign understandably frightens people when it happens, and it should, because it's one of the more serious indicators that something is wrong. When you cough up blood, even small amounts, or notice blood streaks in your mucus or sputum, this is called hemoptysis in medical terms.
As the tumor grows within the lung tissue, it invades the delicate structures around it, including small blood vessels. These vessels can rupture and bleed. Additionally, the tumor tissue itself is often fragile and prone to bleeding. The blood mixes with the mucus and secretions normally present in your airways, and when your body's natural reflex tries to clear these secretions, you cough up this blood-tinged material.
The amount can vary. Sometimes it's just a small streak of red in otherwise clear or white mucus. Other times, you might see frank blood, bright red blood mixed throughout the sputum. Even if it's just a small amount and it only happens once, coughing up blood is never normal and always requires immediate medical attention. It doesn't necessarily mean you have cancer. There are other conditions that can cause this, including severe infections or bronchitis, but it's a symptom that demands urgent evaluation. Don't wait to see if it happens again. See a doctor right away.
The fourth warning sign is something that many people might initially welcome, but shouldn't: unexplained weight loss. And I'm not talking about losing a few pounds because you've been eating healthier or exercising more. I'm talking about significant weight loss, typically 6 to 10 pounds or more, over the course of just a few weeks to a couple of months, without any intentional changes to your diet or activity level.
This happens with virtually all types of cancer, not just lung cancer, and there are several reasons why. First, cancer cells are metabolically hungry. They consume enormous amounts of energy and nutrients as they rapidly divide and grow, essentially stealing resources that your normal cells need. Second, many cancers, including lung cancer, can affect your appetite. You might notice you're just not as hungry as you used to be, or food doesn't taste quite right. Some patients describe a feeling of fullness after eating very little.
There's also a more complex metabolic process at work. Cancers can release substances that alter your body's metabolism, leading to a state called cachexia, where your body starts breaking down muscle and fat tissue, even if you're eating adequately. The key thing that should alarm you is the word unexplained. If you're losing significant weight and you haven't changed anything about your lifestyle, that's your body telling you something is metabolically wrong, and it deserves immediate medical investigation.
The fifth warning sign is chest pain, though it often presents differently than people expect. When a tumor grows in the lung, it can trigger pain in several ways. The tumor itself can directly irritate the lung tissue. As it grows, it can invade the pleura, the membrane that surrounds the lung, which has pain receptors. The growing tumor also triggers inflammation in the surrounding tissues, and inflammation is inherently painful. What patients typically describe isn't the sharp, crushing chest pain you might associate with a heart attack. Instead, it's often a dull, aching pain that's persistent. Some people describe it as pressure or tightness. The pain might be localized to one area of the chest, or it might be more diffuse. It can sometimes worsen with deep breathing or coughing because these actions move the inflamed tissues. The location of the pain often corresponds roughly to where the tumor is located in the lung. It might be felt in the upper chest, along the side of the rib cage, or sometimes even radiating to the shoulder or back. If you're experiencing persistent chest pain or discomfort that doesn't have an obvious cause, and especially if it's accompanied by any of the other warning signs I've mentioned, don't dismiss it. Get it evaluated. While chest pain can have many causes, some benign, chronic, unexplained chest discomfort warrants investigation. The sixth warning sign is the development of wheezing, a high-pitched whistling sound when you breathe. You've probably heard this sound before if you've ever known someone with asthma.
The sound occurs when air is forced through a narrowed airway, much like the sound wind makes when it's forced through a narrow mountain pass. In lung cancer, this narrowing happens because the tumor is physically compressing or partially obstructing the bronchus or bronchiole. As air tries to move through this narrowed passage, it creates that characteristic whistling or wheezing sound. Sometimes you can hear it yourself when you breathe, especially during exertion. Other times, someone close to you might notice it. A doctor can definitely hear it with a stethoscope. The important distinction here is that this isn't wheezing that comes and goes with allergies or only appears when you exercise strenuously. This is persistent wheezing that doesn't fully respond to typical asthma treatments. If you suddenly develop wheezing as an adult and you've never had asthma or breathing problems before, that's particularly concerning. While new-onset wheezing can certainly be caused by asthma or other respiratory conditions, when it's persistent and unexplained, lung cancer needs to be ruled out.
Now, here's the difficult truth I need to share with you. By the time you're experiencing these symptoms, any of these symptoms, the tumor has usually grown large enough to cause mechanical problems. It's big enough to press on structures, block airways, or damage tissue. This is why early detection through screening is so incredibly important for people at high risk. Who should be getting screened? According to current U.S. guidelines, if you're between 50 and 80 years old and you have a significant smoking history, defined as having smoked the equivalent of 1 pack per day for 20 years or more, you should be getting annual low-dose CT scans of your chest. This applies even if you've quit smoking, because your risk remains elevated for many years after quitting. Additionally, if you have a strong family history of lung cancer, meaning you have a parent or sibling who was diagnosed with lung cancer, you may need to start screening earlier or screen more frequently. Talk to your primary care physician about your individual risk factors.
The screening test is a low-dose CT scan, which can detect small nodules and abnormalities in the lung long before they cause any symptoms. When lung cancer is caught at its earliest stages through screening, the 5-year survival rate is dramatically higher, often above 60 to 70% for stage 1 disease, compared to less than 10% for advanced stage 4 disease. That difference is enormous, and it's entirely dependent on how early we catch it.
Let me bring this all together. The 6 warning signs we've discussed: persistent cough, progressive shortness of breath, coughing up blood, unexplained weight loss, chest pain, and wheezing are all red flags that something may be seriously wrong. None of these symptoms automatically means you have lung cancer. There are many other conditions that can cause these same symptoms, but every single one of them warrants prompt medical evaluation.
If you're experiencing one or more of these symptoms, don't wait. Don't tell yourself it's probably nothing. Don't convince yourself it'll get better on its own. Make an appointment with your primary care physician. They can examine you, order appropriate tests, which might include a chest X-ray, CT scan, or pulmonary function testing, and either rule out serious disease or catch it early when treatment is most effective.
And if you are in that high-risk category, age 50 to 80 with a significant smoking history, please talk to your doctor about lung cancer screening if you're not already getting it. Even if you quit smoking years ago, your risk is still elevated. Screening saves lives, period.
Your body gives you warning signs for a reason. The key is learning to recognize them and taking them seriously. Don't ignore persistent symptoms. Don't normalize things that aren't normal. And remember, early detection isn't just about finding disease. It's about finding it when we can still do something meaningful about it. That's the difference between a diagnosis and a death sentence. Pay attention to your body, advocate for your health, and don't hesitate to seek medical care when something doesn't feel right.